How's it work?
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 How about that?
Morning, everyone.
Morning.
So, my name is Brian Ellicott-Cook. I'm the Director of Government Relations at SAVE. I'll be co-emceeing with you this morning, so thank you so much.
Yes.
Okay.
And folks, I'm Anthony Feliciano, Vice President for Advocacy, and I'll be with Brian as co-MCs here. But we have an important thing to do. What is it? There's a city budget going on, right? Yeah. And there's only a few days, few weeks left. But at the same time, we have a federal government that's attacking every single person that's standing right here. If you're trans, if you're a person of color, if you're relying on Medicaid, if you're relying on your life in terms of services that are related to HIV, hepatitis C, anything you think preventively in public health is under attack. All in the name for lining the pockets of the rich. But there's one thing we have us. But we also have the local city council. And locally, when we said local politics is local, it is truly now really local. Why? Because we need our 10 council members to take responsibility, to join us and tell, while you're doing all this to our residents of New York City, we're not going to allow it, and we're going to make sure the movement and the fight we had around ending the epidemic do not go to waste, do not go to the side. That's why we're here. We have city budget priorities that help everyone across all ages, all statuses, all conditions, particularly around ending the epidemic. But the council members have to make sure that the budget stays intact and we find more money for some of these services. Why? Because we have cuts. We have policies coming down. We've already been harmed by the federal government. We have the state that steps up a little, but not enough. And they still have to step up. But we want to thank Councilman Lynn Schulman's office for supporting us. And there are a bunch of council members that are meeting every day around the budget. And they surely understand what's going on nationally. But we need to remind them and look at each other, see our faces, and tell them, we need you to be sure our city budget priorities are in this budget, and you work with us to protect our communities. Is that right?
Yeah.
I want to make sure that we go over some, at least the top priorities, so people know what we're talking about.
So, first one, $12.5 million to sustain and expand New York City's Ending the Epidemic initiative. Second, a $10 million backfill to protect HIV services amid federal cuts. $7.5 million to expand overdose prevention centers. A $10 million minimum enhancement to the Trans Equity Fund. And $10 million to fully fund and reopen all of New York City's sexual health clinics. Does that about right?
Yeah.
And that's 5 out of several other ones, but
Those
we
are
know.
the big ones.
Yep. So, Brian mentioned the money we need to help our trans community. Let's be honest. Many times we end up divided. We think we're not next. But our trans community's been under attack very early on. So I want to bring Kimberly from Callan Lloyd here because we want to talk about not only the city budget, but what's at stake for all of us.
Yeah.
All right, thank you so much. My name is Kimberly Smith. I'm the Executive Vice President of Public Policy and Advocacy at Callan Lloyd Community Health Center. How's everybody doing this morning? I'm here today to urge the New York City Council and Mayor Adams to invest, not to divest, in the fight to end the HIV epidemic. Now is not the time to backtrack. Now is the time to sustain and increase the city's investment in ending the epidemic. That $12.5 million that Brian talked about, that $10 million, and so on. At Callan Lloyd, we provide passionate, affirming, life-saving care every day to New Yorkers most impacted by HIV. In 2024 alone, we delivered comprehensive HIV care to over 4,100 patients, about 1 in 5 of our total patient population. Actually, we are the largest non-hospital-based HIV care provider in the city, and we write about 15% of all PrEP prescriptions statewide. You know that we as a community and as a city have made extraordinary progress, but that progress is not yet equitable. Disparities persist in who gets tested, who gets PrEP, who gets linked to care, who gets and stays on PrEP. We know that Black and brown New Yorkers, transgender New Yorkers, older adults, and women are still underrepresented in our prevention efforts and overrepresented in new diagnoses. So we cannot allow budget cuts, whether federal or local, to unravel decades of community-driven work. We must close the gaps, not widen them. If cuts and some of these consolidations proceed at the federal level, less people will get on PrEP, less people will get tested, less people will know their diagnosis or be linked to care, and so on. And specifically with regard to prevention, guess what? Breakthroughs are here. In just a few days and weeks, we will have a new PrEP option, ultra long-acting PrEP. So now we have multiple PrEP options. So we are on the cusp of innovation, but none of that matters if people can't access or afford them. So we must ensure that the cost is not a barrier, that community-based clinics like Count Lord and others are reimbursed for the work we do, and that prevention outreach programs remain robust and sustainable. Federal dollars through CDC help drive this work, but we cannot rely on them alone, especially in an uncertain political climate. If federal funding falters, New York City must step up to meet the need. We need to be ready and we need to be brave. Local investment is not just a budget decision, it's a public health imperative and a moral responsibility. We are closer than ever to ending the HIV epidemic, but we will not get there by cutting back. We will only get there by investing wisely, equitably, and urgently. Thank you.
When we fight, we win. When we fight, we win.
When we fight,
We win.
when we fight,
We win.
Thanks, Kimberly. So really quickly, I'm going to talk about older adults. Again, I work at SAGE. I'm the Director of Government Relations. Older adults have lived through the epidemic and is still living through it and dealing with the loss of their peers, their neighbors, their lovers, their friends. And they still are at a point where they need access to care, to services, to community. So that's all part of this, as well as making sure that they continue to have access to their medications, to meal service, to group. So all of that is to say that whether you're an elder, you're a youth, you're trans, you're a person of color, all of this is intersectional and all part of the fight for why we need expansion for these services, and with the support of Councilmember Schulman. That is essential. So I want to bring up next Lewis, who's going to talk about peer organizing from the Alliance for Positive Change. Thanks, Lewis.
Good morning, everyone.
Good morning, buenos dias, buenos dias.
Buenos dias. I'm from the Alliance for Positive Change. I'm the project manager at the Alliance for Positive Change, the Advocacy project manager. And we are leading in a peer-based organization. New York City can and should lead the nation in peer-driven health equities. Studies consistently show that investment in community-based peer delivering prevention and care services reduce new infections. So we are asking the City Council to make these public health investments. As a peer workforce development agency, we have seen how hiring culturally competent workers and valuing lived experiences not only saves lives but drives youth growth, drives job growth. Now is the time to fully fund an investment in health that we now work. Being on the front lines of HIV prevention and treatment for decades, we know that peer-driven health services, harm reduction, easily accessible health clinics saves lives. these investments are always effective, reducing new HIV infections and help at-risk New Yorkers live healthier lives. Ending the epidemic in New York is possible with common sense investments and cures. Thank you so much.
Thank you. Let me give you a little stat here. In 2023, the HIV surveillance annual report said that a little bit over 1,600 people were newly diagnosed with HIV in New York City. That's down 70% from all our work, right? And with the city and the State Department of Health. But we know there are really stark inequalities when it comes to Black, Latinx, Latino communities. We know there are stark disparities around our trans brothers and sisters. We know men sex with men also. Those are still important communities to us that we need to do a lot of work so we can also have HIV down in those communities. But we can't do that unless we have a robust city budget. And so part of it is about people with the lived experience. Because lived experience is lived expertise. It is what we fight to ensure in our leadership, in our work. I want to bring Denise Letard, who's our Housing Works peer organizer for Ending the Epidemic initiative.
Good morning, everyone. My name is Denise Letard. I'm the community mobilizing peer for the ET initiative at Housing Works. Now, the ET initiative has a goal to end the epidemic by 2030. And that is already a very short time to achieve it. And we cannot achieve it without the help of the City Council. We might lose the government, the federal government. There was a big march this weekend against the government, and it was a big success. And I think we have to take that spirit and bring it with you and spread the word with everybody you know, not only within the community, but outside the community. Personally, without Medicaid, I wouldn't have an apartment. I wouldn't have my medication. I probably would be dead. I've been living with HIV for 25 years, and something I never thought would happen is happening. They're cutting the budget, and we might end up being sick and on the street. So I don't think we're going to let that happen, are we? No! Good. So please join us and keep the fight going, and I thank you very much.
Our End the Epidemic Community Mobilization Coalition is 90 plus organizations. That's power in itself, right? And while we're not all here, it's because we're on the ground all doing the fight, right? So I appreciate that you all are here. There is one thing I want to talk, and Denise Letard said, in the spirit. There are mobilizations across this nation, in this city alone just the other day, right? That same spirit, we need to continue doing so. I want to mention that our partners, Advocacy, is also here. And it reminds me that on June 25th, we are also with Advocacy in their leadership and pushing this. We're going to be at the AIDS Memorial and having a rally press conversation about the cuts to Medicaid, because we don't end the epidemic unless we protect Medicaid.
Right.
We don't end the epidemic unless our council steps up. And so this is not the only time we stand together. And so I want to encourage and really ask for our responsibility, for those who can't always be here, is for us to do so. So I want us to be on June 25th, also with Medicare. We're doing a sign up, Medicare is doing a sign up, but this is important, right? We cannot have our council members lock arms and then say they can't do anything. They can. We've been here before.
Right. Yes.
When we wanted to get the roadmap done in the state and in the city, we were here before.
Right.
When they made excuses that there's not money there, we were here before.
Right.
And so we know we have good allies at the council, but we need to have our Councilman Health Committee Chair, Lynn Schuman's back.
Right.
There are people in the budget negotiation team meeting every day right now.
Yes, it is.
They're not even meeting with folks anymore as much as they used to.
Yeah.
So that's why we're here.
Yeah.
We're visibly here because we need to do so. I want to have. Do you want to? We have a council member that we're holding off
We're trying to hold on.
to make sure they get here.
I'm going to talk about sexual health clinics and then
yeah.
hopefully they'll buy us.
Yeah.
Butcher is coming.
Yeah.
Butcher is coming back.
Okay. So the last point on here, as I mentioned earlier, is $10 million to fully fund and reopen New York City's sexual health clinics. Sexual health clinics are a critical lifeline for marginalized New Yorkers, especially BIPOC, LGBTQ, low-income, and underinsured communities, who rely on free and low-cost, judgment-free care. Reopening all these clinics ensures equitable access to STI testing, treatment, PrEP, and care. Believe it or not, New York City is facing rising rates of STIs, including syphilis and gonorrhea. And while we are bringing down the rates of HIV, they are still going up.
Right.
Right? That's not okay.
No, it's not.
Down is good. 0 would be better.
That's right.
Fully funding and reopening these clinics is a proactive measure that helps curb infections, reduce transmission, and avoid overwhelming visits to urgent care and emergency rooms.
That's right.
Why would you go to those places when you could go to a sexual health clinic? Or a Calendar?
Right.
The same. But this is also about health equity and health justice. A few years ago, we had a monkeypox outbreak. That could have been severely mitigated by opening and keeping open those sexual health clinics so that we could get access to the vaccines, so that we could get the information out to the community.
All right.
Right.
We're still waiting because obviously they're in the meeting, all the council
We're in
members,
a meeting probably about the budget.
right? So that's good,
Hopefully.
right?
Oh.
But I just want to,
I can say something.
yeah,
Okay.
now we got Joey.
Now he's motivated.
So let me do a formal, better introduction. Joey Presley from Amita Care.
So, my name is Joe Presley. My pronouns are he, him, and his. I'm the Vice President for Public Policy and Government Relations at Amita Care. Now, I wasn't going to say anything, but I felt compelled to because, you know, there are forces in this country that are saying to us that we should not be raising our voices. They are trying to intimidate us. They're trying to scare us. And we say, hell no. We are going to raise our voices.
That's right.
Whether it's here at City Council, whether it's up in Albany, or whether it's down the turnpike down in DC. Our voices matter. We can win this. They want us to believe that we cannot. And so the attacks, as we know, on Medicaid, on the safety net services, on food stamps, on HOPWA, on CDC prevention, it's horrific. But you know what? Our voices matter. And we've got to be here at City Hall raising our voices. Because if we don't, you know what? They actually do win. And so when we call upon you, when we call upon us to raise our voices, whether it's in demonstrations or writing letters to elected officials, we've got to stand tall. We got to raise our voices. We got to make certain that we push back on these horrific cuts. So it's so important that we're here today. Thank you, Housing Works. Thank you, SAGE. Thank you, Callan Lord. Thank you to those of us who are living with or at risk for HIV and AIDS. Thank you to the trans community. If they come for one of us, you know what? They're going to come for all of us. There are people in the lesbian and gay community that are saying, you know what? Let them go for the trans people. That does not work.
No, it doesn't.
Same church, different pew. We are all together and we've got to stand tall in this fight. So as was mentioned on the 25th at the AIDS Memorial at 11 a.m., rain or shine, we need people to show up and raise their voices along with all of us and people from across the city. Thank you for being here. This is so extremely important.
I want to be very clear. We got a lot of distractions happening. The council is busy, obviously, with the budget. That's what we're here for. but those distractions also distract them.
That's
And
right.
So part of our job, I'll tell you right now, and our responsibility, I'll tell you first what's going to be my responsibility and how they're catching right now. We're going to use that to send it to them
That's right.
and let them know what you missed.
Tell
And then
them.
let them know what you need to do.
Tell them.
So now, there's responsibilities on together now. We need you to call your council member. We need you to explain the 5 top priorities. Right? We need you when we send out an alert, which you all have done, make that call, send that email. But you have each a friend, a family member, a neighbor, even a stranger in the street, to tell them what's going on. You don't need to know all the stats, all the data. You need to know the stories.
That's right.
You need to know the faces. You need to remind people that when federal government or any other government breaks their promises, denies our care intentionally, uses ism like racism and fascism, and hides it under other types of words, language, right? To make it sound like they're making us so-called healthier. That's not what's happening. That we tell the council, we see you, you're here locally, you represent us, we voted for you, so step up. There's plenty that's going to step up there, but they're going to have pressure. Why? Because we have so many needs, right? We have so many things that we deserve. But we can do this. I don't want, in the beginning, when I first started working around HIV and AIDS, to see more loss of friends and neighbors. There's a reason why people are living longer, right? Regardless of all the things we still need to fix. We need to have that happen and continue. There's no point in this movement if we lose lives and we continue to. What is happening right now is unprecedented. I say that because we have an administration federally, and I know we're here in the city council, who not only don't care, who have said it's okay for us to die. Their cronies have said it's okay to die. Let a few people die, that's okay, that's what happened.
That ain't right.
That ain't right. We have council members that don't think that. But we have council members that sometimes believe they don't have the power. Why? Because it's national. They have a lot of power. They have the purse strings to provide the resources that allow us, from Alliance to Callan Lloyd to Medica and others in our 90 plus organizations, to do the work from stage and on. That's what's important. We have to remind our council members, our brick and mortar buildings have people in them, have people going in them. It's not just brick and mortar. It is life, it's value, it's love. And this kind of hatred that we're dealing with, we have to love each other. But you don't love each other if you believe that you're not next. You don't love each other if you don't believe to tell somebody else you can be next.
Right. Never say never.
And let's be honest, we're not one identity. We have multiple identities.
Right.
You can be a trans and an immigrant. You can be a trans and undocumented. You can be many things. That's what makes us beautiful. But that beauty is being erased. The council can do one very basic thing right now. Make sure that our priorities are in the budget. Make sure that there are enhancements that where we can fight to protect our communities and they can move forward. Then we can talk about all the policies and things they need to do while they're still here. But right now, it's about the funding and the resources. And talking about funding and resources, because Eric is a really good person when he comes right on time. Eric Botcher is our council member, not only for the caucus work, but he's been with us when it comes to ending this epidemic and in the budget having a good fight. So I want to bring our councilman Eric Botcher.
Hey everyone, So I am so grateful to be here because this is very important. We've made a lot of progress since my time in government with respect to HIV and AIDS. And a lot of that is due to the advances in medicine and science. A lot of that, though, is because of the critical programs that we have implemented here in New York City. Programs that are by all the incredible organizations behind me right here on the steps of City Hall. We cannot take that progress for granted, and we cannot assume for a minute that this progress won't backslide, that we won't see infection rates skyrocket, that we won't see deaths skyrocket in New York City. And make no mistake, that is what is going to happen if we zero out these programs. So as we negotiate the budget with this administration, I want everyone to know that the City Council LGBTQ IA+ caucus, that we are fighting for not just to maintain the funding we have, but to increase the funding we have. In the richest city, in the richest country in the world, people should not be dying of HIV and AIDS 2025. People should not be going hungry in New York City. People should not be living on the streets in New York City. People should not be dying of untreated serious mental illness in New York City. People should not be ending their own lives in New York City because of vicious discrimination. But that is what is happening. So let's be the city that we know we can be. I know we can be the city that cares for all our residents. As we celebrate 400 years of history in New York, I know that we can rise up and be the best that we've ever been. But that won't happen unless we fully fund and increase funding for these critical programs. I want to thank everyone here who's devoted their lives to helping our fellow New Yorkers, because that's exactly what you've done. That's exactly what you're doing. And we are here with you every step of the way.
So, I think we understand what our assignment is. I think we understand what our mission is. And I think we know what we all have to do, which is harass our council members about this funding. Sorry, Eric. So regardless of where you...
Can I add something to that? I apologize.
You may. Go ahead.
Will you give Brian a round of applause? We worked with, as an intern in 2009. We go way back. It is so important that in the run-up to the budget, all council members are hearing from environmental groups, school groups, parks groups, housing groups, all very important. But it's hard to break through all of that because a lot of council members are like, you know what, let's just take a message at this point or overwhelmed. So one critical thing that you could be doing is having residents of those districts reach out, constituents of those districts reaching out. And so if you're a citywide coalition and you're calling a council member in some part of the city, one important thing you can do is try to identify people who live in that council member's district and have them call the council member and say, I am a resident of council member so-and-so's district and I want to speak with them. I want 10 minutes on their schedule to speak to them.
is a
There
wonderful
was an
thing.
election going on, so council members were particularly apt to like for me, any time of year when a resident reaches out, when a constituent reaches out, it's like, okay, yeah, let's get them on the phone. So try to identify people who live in those council members' districts, have them reach out, say, I live in the council member's district, and this funding in the budget is important to me and my family.
Thank you, Boucher.
So regardless if you live at the top of the Bronx or at the base of Staten Island, if you need help identifying your council members, come talk to me. I know where they all are. I've been known that. But it's like the council member said, it's important. Your voice to your members matters. Your voice to your representatives.
That link to other people, share it. I know Hollywood staff always see it as an alert to the staff, but that link can be given to other people. We've done that before. We have to make sure they hear it. Eric is correct about they want to hear from their constituents. We have power together and we can make this happen, right? Yeah. Thank you, everybody. How's it work, folks? Who did not sign in, please sign in. How's it work?
How's it work?
How's it work?
How's it work?
I have to sign this here, right? Yeah. Hola.
Orgulloso de ti, me encanta, me encanta.
Gracias.
Divine inspiration.
The rally is over. It's finished, 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 finished. It's after the rally. It's finished. Finished, 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 finished. This is me. You can give it to just put him here. Put him here. Thank you. This is me. You see that you watch the video. Don't forget to like, subscribe, and comment, and share it. Okay? A like is free. You don't have to pay for it. So support the channel, and support the channel financially too. We need funding, so support it. Okay? Thank you. The way I record it is the way I'm to upload the video. And thank you for watching the video. Bye bye. Thank you. Bye bye.